Thank you so much for joining us at Worldview Wellness with Health Matters, episode 3.
Number 3.
Today we're going to be talking about our chronic illness and disease package, which goes pretty deep. We've got an onboard and a deep dive, which we assess in a really detailed way. We look at people's terrain and we use lots of specialty kits and labs to do that. We've got lots of folks with different ailments that we use the deep dive for, and we've actually had clients come in and do the deep dive just to assess their entire body system. So that's what we're going to be talking about today. I'm Ty.
And I'm Micah.
And we appreciate you guys joining us. So, Micah, let's start with the complex chronic illness package, how we work through that. I guess we should start with what kind of illnesses we see in our business that are more of the chronic complex illnesses.
We see probably the majority of our clients right now are struggling with cancer. Mm-hmm. Or I should say thriving with cancer.
Thriving with cancer.
Yeah. We have people with all kinds of cancer, prostate cancer, breast cancer. We've seen people with brain cancer, blood cancers, pretty much you name it.
And some funky illnesses too.
Yeah.
Like POTS. We have several women in our service who have POTS. Would you explain what that is?
So POTS is an acronym. It stands for Postural Orthostatic Tachycardia Syndrome, which basically means that pretty much everybody can identify with this at some level, because at some point in your life, I'm sure that you have stood up really fast and gotten lightheaded.
I have, yeah.
Well, so most people could probably say that they've experienced that before. So somebody with POTS, those symptoms are just taken to the next level. They might actually have syncope or pass out. They can have a heart rate that goes up significantly elevated, even up into the 200s and above, just when they make those what we call orthostatic changes. And that basically just means postural changes. Going from sitting to standing, going from laying to sitting. So when that happens in your body, your autonomic nervous system, your sympathetic, fight or flight, your parasympathetic, rest and digest, those two systems have to constantly work together regarding, your emotional state, your position in space, whether you're right side up or upside down, to adjust your cardiac function and your sympathetic tone to keep things appropriate so that your body can be perfused, which basically just means that you have good blood flow and oxygenation to your tissues. So as your position changes, as those different states in the body change, your body has to work to adjust how it functions to keep the oxygenation of your tissues steady. And so somebody that has postural orthostatic tachycardia syndrome, or POTS, basically that their autonomic nervous system is dysfunctional. It's a dysautonomic pathology anyway. So how do we deal with cancer or POTS or Lyme disease or fibromyalgia or any of these complex chronic illnesses? Is we do a very what we call the deep dive, which is a very thorough terrain workup. So we look at anywhere from, like in the last episode, we talked about a lot of the basic labs, and then we threatened you guys with talking about more advanced labs and whatnot.
And here we are
into today. So, so we go very, very deep into the systems of the body. So we look at those basic labs, and then we add to those basic labs, and we get more serum blood work that really covers a much larger swath of the terrain than just the basic labs do. When you're just basically looking at the basic organ functions and metabolic function and what you can find out from the blood labs.
Well, let's start at the beginning, because really anybody can do the deep dive. If you want to find out about your full body terrain, how everything's working together, what is optimal and what is not, anybody can do the deep dive. And it really is a fantastic full body assessment that we can help you gain optimal health through lifestyle changes, supplements, things of that nature.
There's a lot of people out there that think, oh, I'm relatively healthy and everything's fine, and that's really just based on the conventional understanding of what health means, which I would, make a very good argument that that's a really poor understanding. you know, a lot of people struggle with all kinds of different things that they just don't consider as part of their health. They might be a little bit tired, or they might kind of have aches and pains, or they might, have brain fog, or, any of those things. Those are very common complaints in our country. And
two, I want to say that a lot of people don't realize that they don't feel well until they start to feel better.
Right. Yeah.
Just something I notice all the time.
Right. Yeah. So, as we age, and, you could also look at this from a health issue of like maybe a smoker. It's not like your lungs completely rebel against your body on day one of smoking cigarettes. That's a slow, gradual deterioration of function. And so a lot of people that are diagnosed with things like COPD, or chronic obstructive pulmonary disease, which is much more common among smokers just because of all of the, the inflammatory damage that they do via smoking cigarettes. That is a slow accumulation over time. And so, when things happen slowly over long periods of time, you tend to not notice those. And so you might tell somebody, which I have, multiple times throughout my career, I can tell by listening to you talk that you probably have COPD.
Yeah.
And, typically, the response I get is someone that looks at me kind of like with the saucer eyes and like, what do you mean? I breathe fine. And, I basically tell them, well, let's do a pulmonary function study, because you think you breathe fine, but that doesn't mean that you do. Right. You breathe fine because you're used to how you breathe, and right. And whatever deterioration that has come from your years or decades of smoking is not something that happens all of a sudden. So your bar to measure how you breathe doesn't seem to really change, but over time it really, really does. And so that really is a good analogy to talk about general health and the even in a non-smoking population. There's a lot of things in our environment that contribute to degeneration in our health, our diets, our, sedentary lifestyle. In the last several years, they've kind of considered being sedentary the new smoking. Yeah. Being exposed to toxins. People are very, very uneducated about, what toxins are, common in our environment. Pesticides and herbicides, even if you're trying to eat the healthy foods, but let's say you're not eating, an organic diet, glyphosate's a big one. It's a carcinogen by the, several years ago it was designated a carcinogen by the International Association of the Research on Cancer.
Yeah.
And then there's just tons of those things in our environment. Even in just regular municipal water supplies, there's multiple chemicals in the water that we're drinking if it's not filtered, purified water, chemicals from plastic. So pretty much the average American is ignorant to a lot of those things. And all of those things you could, you could say are maybe similar to smoking in that it does cause inflammatory damage to our body over time. And we have a slow deterioration of function. So what we really aim to do with our deep dive analysis is to try to uncover as much of that as we can and try to catch things before they become noticeable.
Mm-hmm, mm-hmm. So let's start at the beginning, because it can be kind of an overwhelming process. But we test, assess, address, never guess. Thank you, Dr. Nasha Winters, for that. And we first start out with an intake form. The intake form that we use is a pretty big one, 53 pages, and we want everything. We want detailed family history, we want detailed diet, we want detailed medications, supplements.
There's a lot of emotional stuff in there, so
yeah.
There's an adverse childhood events score in there, because that, the trauma that we go through in childhood, if you look at the social science on this, there are big implications for your long-term health.
Yeah.
Depending on whether those unresolved emotional issues are dealt with or not.
Well, so we ask our clients if they are looking into the chronic illness onboard and deep dive. We tell them to be as honest as they can be for the onboard intake form. And like I said, it's a big one, but then that first lab panel that we get is huge. And we have a lot of clients ask us, well, can't my doctor run those labs? I've got those labs, but it's completely different. So talk about our big onboard panel.
Well, so our onboard panel it covers Now, I would say that it's primarily geared for someone that might have a cancer diagnosis.
But we also customize those labs, so we can
Yeah.
gear it towards anything.
Yeah, absolutely. But having said that, it's a very comprehensive evaluation from
Yes.
a serum lab standpoint. So, what I would say is that even though it is geared toward cancer, lots of specific labs that go much more in depth on the metabolic function, and a ton of inflammatory markers that go down different pathways. It really is a very, very complete serum assessment of total health.
Well, so this is kind of how the process works. Whenever someone gets in touch with us and they want to know about the business, I'm usually the one that talks to them, and I am a client advocate. I was trained in the Terrain Advocate program through Dr. Nasha Winters. And it really, I love doing it. I love the contact that we have with our clients, but I basically walk people step by step by step through the onboard and the deep dive, because it is, and I say this to every one of our clients, you guys all know it's a big meal and we eat it together one bite at a time. So we have a huge intake form, 53 pages. We get the huge lab panel. I walk them through that. And remember, guys, we do have a company that we use called Avexia Diagnostics for direct-to-consumer labs. So we put in the lab order, you pay the lab order. All you have to do is print off your requisition form, take it to your local LabCorp or your local hospital, whichever has been designated, which I help you figure out and choose, and then you can move forward to getting your draw, which you've already paid for. So once we get the intake form, once we get the lab panel back, we then sit down with our clients for a 2-hour Zoom consultation and just really get to know them. We talk about the intake form. We talk about the labs. We talk about previous diagnosis, medical history, where they're at, spirit, heart, mind,
Mind, body,
soul.
spirit.
Yes, we are engaged in every bit of it, because we don't see our clients as a person with lab numbers. We see them as children of God, created in His image, and we treat them thus.
And we also understand that, in medicine, and the way that I practiced whenever I was practicing medicine, and then of course, I've taken what I learned there from my medical role, into the consultant role. One of the most important factors in that paradigm is the relationship that you have with your medical provider, with your consultant. So we really like to spend a lot of time with our people so that we can develop that relationship and come to get to know each other. Not one of our clients is the same as the next, and so it's really important that that we both get to know our clients and that they get to know us.
Yes.
And so that we can have more of a personal relationship, which really helps us to implement the plan, and it helps the client to implement their plan on their end, because I can make the best recommendations, the most thorough, complete assessment, and if that relationship isn't there and that trust isn't there, then it can be very difficult to walk that plan out. I mean, I always tell my clients that I have the easy job. I get to sit down with your labs and your intake form for a few hours and put together a really good plan for you based on your terrain. But then you have the hard job. You have to go home and you have to do all of those things, and that can be overwhelming at first. Under the best circumstances. So.
Which is where my job comes in as the advocate.
Yeah, absolutely.
I am the mediator between Micah and the client, and so any questions that they have, I'm available to our clients who have paid for advocacy during business hours at any time. And we are pretty good to get back to our clients with same-day answers, and we just want them to know that we're here for whatever they need. So once we get to the onboard and you have already got a plan prepared, you've already seen the labs, you've already seen their medical history, their diagnosis, you have seen the intake form, and so you have a very well-rounded set of histories on our clients, and so you move forward with a plan, and by the time we meet with you guys in the onboard, we've already got that prepared foundational plan ready to go. So we go over the intake, the labs, the plan.
All of the conventional diagnosis and pathology and labs and all of those things. I mean, that's kind of where I start, that in the intake.
And also something that I really love about our business is that anytime we sit in an onboard or a deep dive, I'm continuing to learn new things and pretty dazzled by the information that you give to our clients still. And we've been doing this for 2 years. So I love this kind of personal contact, but more to the point, we're able to really walk, and as an advocate, I'm really able to walk the person from the onboard to the deep dive. So after we're done with the onboard, our clients are emailed this very detailed plan. Mm-hmm. We open a full Scripps account for our clients so that they can get all of their supplements in one place. You've already got all that together for them. So everything is very streamlined. And so once we get through the onboard, then we order the specialty kits, because after all of this terrain assessment, after the intake form assessment, the lab assessment, after you've got their plan together, you have a really good idea of what kind of specialty kits you need to see on them and move forward with. And so after the onboard, we then order the specialty kits through Avexia, and I'm going to let you explain all those kits in just a second.
Okay.
And move forward with those kits, which are drop shipped after they're paid for by our clients. They are drop shipped to your house for ease of use and comfort. You're able to do them at home. They are very detailed with instructions, and then you send them back in. Then we get the results and we move on to the deep dive. But I think I really want to talk about the specialty kits because labs are great. We get tons of labs, but people really have a very small, and even physicians, we have physicians contact us and ask us questions about these specialty kits because they don't do them. They don't understand. It's just a different type of training.
Yeah, absolutely.
So,
it doesn't, that's not saying anything bad about, conventional physicians. I think that, the rule of thumb that I've observed in my career is that, the vast majority of physicians and other medical providers that are out there are, pretty good people, and they got into medicine because they want to help,
right.
and they like humanity, and they want to continue to see people thrive, and they want to be part of that. So, but we're, and I can speak on behalf of some, conventional medical providers, because I certainly, was one. Mm-hmm. Prior to starting to learn about some of the integrative functional medicine stuff that I know now. But the training that you get in medical school does not really lend itself to advanced lab interpretation, and certainly doesn't teach you a whole lot about specialty kits and detailed hormone labs and gut function labs and genetics.
Right.
And I went to medical school well over a decade ago, but
well over a decade ago.
But back then they were just starting to kind of touch the surface of, there's this genetics is important. Mm-hmm. So we need to start, in the future we'll have all this personalized medicine based on genetics. That really hasn't, to the average person out there, that really hasn't panned out, even though those things are available now. And we look at those things in our, in our business, but that's not something that the average person out there really has any access to.
So this is a great place to start. You just brought up the Nutrition Genome, a genetics test that we use, and let's let that be the first specialty kit that we talk about. That kit is also drop shipped to our client's home. It is a cheek swab, mm-hmm. Very easy to initiate. But talk to us a little bit about the Nutrition Genome and kind of what you think about it.
Well, the Nutrition Genome test really allows me to personalize my recommendations in a way that, I can't really say about anything else, because it's in a lot of ways, it's across the board. It's basically my lifestyle guide that I give to somebody. Now, a lot of the recommendations may end up being similar, but so it looks at, I want to say it's somewhere in the neighborhood of 100 genes. And then on those genes, it's actually looking at things called SNPs. Yeah, that's in the medical jargon or vernacular. SNPs is SNP apostrophe S. That stands for single nucleotide polymorphisms. And so those are basically little hiccups in your genetic code where you've got the base pairs in your DNA, and one of those might be taken out and replaced with a different base pair. So you've got your your ATCGs. And if you have a T that gets replaced with a G, then that, you could consider that a single nucleotide polymorphism. And so based on that genetic information, I can see, okay, well, what kind of diet is actually going to be suitable for you? One of the things that we commonly recommend for people is a ketogenic diet. But there are specific cases, based on the genetics, where a ketogenic diet may not work for everybody.
Right.
And so, there's no such thing as a panacea diet, that like one diet that's great for everybody, based on the genetics. Some people have little hiccups in their inborn metabolism, little errors in the metabolism based on their genetics or based on their SNPs, and I can assess those and identify those in assessing that nutrition genome. I can look to see, whether somebody is able to convert beta carotene from fruits and vegetables into retinol, which is the actual vitamin A that your body uses. Mm-hmm. There's a gene called BCMO1 that, if you've got some problems with that gene, well, you could eat carrots until your entire body's orange and you're not going to get enough retinol because you don't convert that efficiently. And that's actually a very complex process of over, I think, 35, individual biochemical steps. There are genes that like FADS2 that are looking at omega-3s and, whether you can actually convert plant-based omega-3s into animal-based omega-3s, which is what your body uses in order to, carry out a lot of the processes that you need lipids for, and energy transport and metabolism and all kinds of other things. There's several genes that look at hormone function, like CYP3A4 and CYP1B1. So I can assess those to see what or what I might likely see on a hormone test to see how your body is metabolizing estrogens. I can look at genes to see what your need for vitamin D is, and we could sit here and spend the entire rest of the podcast talking about the nutrition genome and just barely scratch the surface. But it's a really thorough analysis, and it kind of lets me see what the soil looks like, mm-hmm. So that I know what to plant.
So the thing that I loved about the nutrition genome is that it will literally even tell us whether caffeine is good for our clients. Mm-hmm. And for some it really is. So we can get good grocery lists off of the nutrition genome.
Absolutely.
We can tell what kind of exercise is good for somebody, whether they are a shallow breather according to their genetics and things of that nature, which is interesting. I just was blown away when I started to really learn about the nutrition genome. But let's move on to... let's talk about the GI map, which assesses gut function. That is also one of Avexia's specialty kits that we order.
Yeah, absolutely. So the GI map, basically, that's probably not the pleasant or the most pleasant collection, but it's easy. It's basically a stool sample. So you collect some stool, we send that off to the lab, or you send that off to the lab. We don't do that for you. You send that off to the lab, and then they basically, through their methods, break down that stool and then analyze the DNA fragments that are in the stool. And through that, they can assess, down to the specific microbe, really, or I should say class of microbes in some cases, but they're actually looking at how your microbiome is made up. You have normal bacterial phyla and flora that should be in your gut, and so they look at all of those via the DNA fragments, and they're able to say, oh yeah, well, so your normal bacterial flora is adequate. Or maybe you have an imbalance. Maybe your Firmicutes species is above your Bacteroidetes species, or the other way around. And so there's maybe a little bit of an imbalance there. Or maybe you're high in both of them and you have a condition called SIBO, or small intestinal bacterial overgrowth. Or maybe they're both low and you just need loads of probiotics. So we analyze that. It also looks at DNA fragments and evidence for parasitical infections, viral infections, bacterial infections, bacterial overgrowth, which maybe is not pathological bacteria, but that could indicate that maybe you have something that's overgrown and it's just not part of it shouldn't be part of your normal bacterial flora, and certainly not overgrown. So we look at all of those things. And then last but not least, we look at the lots of markers for whether you have a leaky gut. There's a protein called zonulin that we look at to see if there's evidence that you have a leaky gut. That's a protein that's very, very important for your immune function, because if you have a leaky gut, then basically your immune system is getting exposed to things that it shouldn't be seeing. It's being exposed to macromolecules and proteins that haven't been adequately broken down into amino acids and whatnot. And so I look at those. I look at inflammatory markers. I look at some of the enzymes that might be associated with dysfunctional hormone metabolism that actually happens in the gut. So I can compare that to more advanced hormone analysis. There's a lot that I go over in a GI map, and then that allows me to make recommendations to get someone's gut back into proper function.
Well, most people have a leaky gut these days.
I would agree with that.
Would you give us a really quick assessment or description of what leaky gut is? I love the way that you explain it, so let's just tell our listeners kind of how you see that.
So you think of your gut, basically anything past your lips and all the way to the other end, that's your gut. And so once you get down past the stomach,
from the rooter to the tutor.
That's right. So once you get down past the stomach, your small intestine that's made up of 3 different segments, and then your large intestine, there's basically a one cell. It's the thickness of this lining, what we call the endothelial lining of the gut, is 1 cell layer thick, according to what we know in science now. And so each one of those cells has to be held together to the adjacent cells via this protein that goes through the membrane of those cells called a tight junction. And those tight junctions are just little proteins that hold those cells together. So when you have leaky gut, basically what happens is those tight junctions, those proteins break down. And they can break down for any number of reasons. They can break down from infection. They can break down from inflammation. They can break down from poor nutrition. And there's a whole plethora of different reasons why that those tight junctions might break and start to fail. But ultimately, what the result is you have cells that get pulled apart, and so now you have a hole in that 1 cell layer thick endothelial lining. On the other side of that lining, you have a very, very specific tissue that's a major part of your immune system called the gut-associated lymphatic tissue, or GALT. And so that GALT basically should only be seeing things that have been assimilated by those cells, by the endothelial lining cells, and then have been processed through those cells, and then everything that gut-associated lymphatic tissue should be seeing would be nothing more than the basic parts of your food. So we're talking about amino acids, simple sugars, fatty acids. It should not be seeing strings of carbohydrates. It should not be seeing macromolecules, whether that's, complete proteins or even partial proteins that haven't been broken down into their respective amino acids. It shouldn't be seeing that kind of stuff. It shouldn't be seeing complex lipids. It should be seeing the fatty acid. So whenever the GALT starts to see this, there's this concept that is called molecular mimicry. And basically when the GALT sees these proteins, the GALT understands, because it's part of you, it's part of your immune system. So the GALT, the gut-associated lymphatic tissue, understands what you are. But now you're eating something that's maybe a cow or a pig or a protein from an egg or whatever. Or a Nabisco shredded wheat, or, and so now the GALT might be seeing those proteins that in some ways look like you do. We have a lot in common with other mammals like pigs and cows and things like that. And we have simple sugars and carbohydrates in our body. So the GALT can get confused by thinking that, this protein that has, or molecule that's come through the leaky gut, maybe it looks something like your pancreatic cell, or maybe it looks like a thyroid cell or a thyroid enzyme. Maybe it looks like a component of the skin, and so you might get eczema because now all of a sudden your immune system, based on what the gut-associated lymphatic tissue has seen, now starts to attack your skin, and all of a sudden you have eczema or psoriasis, or you end up with with a case of type 1 diabetes later in life, or you end up with, any number of different autoimmune diseases, autoimmune thyroiditis, Hashimoto's disease, rheumatoid arthritis, psoriatic arthritis, all of those are autoimmune disease, are immune diseases. And I think that one of the things that a lot of those people have in common, maybe not 100% of cases, are due to leaky gut, but I think that that's one of probably the most significant sources of autoimmune disease.
That's a great description. Let's move on to, you did talk about organic acids. Let's move on to the EPP and organic acids test that we do.
So that's basically, EPP stands for Environmental Pollutant Panel. And it's actually not my favorite environmental test to get on people, but it is the best one that that we can order through Fullscript. Now we have
through Avexia, rather.
Yeah, I'm sorry. Fullscript is our supplement company, and Avexia is our lab
Let's not
company.
get the two confused.
Yeah, let's not do that. So the EPP is the best environmental panel that we can order through Avexia. Although I have been in contact with Avexia, and hopefully sooner rather than later we'll actually be able to order what my favorite environmental test is, which is called the GPL Envirotox panel.
It's a good one.
I prefer that one, although the EPP is a really, really good test as well. And so basically what that does is it allows us to look for common environmental pollutants and whether they're in your body or not. So we might be looking for styrene. One of the things that you said we were talking about earlier, Ty, was that you've seen a lot of people eating out of styrofoam lately, and it drives you crazy. Well, that's because that there's a lot of endocrine disrupting properties of the chemicals that are in styrofoam. Same thing with plastics. Same thing with a lot of the herbicides and pesticides that we commonly are exposed to. And there's just a whole plethora of chemicals that are in our environment that are either on the list of carcinogens or that are questionable, probable carcinogens. And you can look a lot of those up on the IARC website, the International Association for Research on Cancer. They're probably the most, I would say, progressive as far as being able to go and the studies that they do and the testing to see what chemicals are actually impacting human function. So we basically test for those. And then if we find exposures, then of course, the functional medicine rule is the first thing you got to do is get rid of the exposure. The second thing you got to do is open up the body's ability to detoxify those things. So we might do things like, GI binders, saunas, certain light therapies, all kinds of different things to help someone detox. There's also CoQ10s and N-acetylcysteine and
would a coffee enema be included in something
absolutely
like that?
Yeah, coffee enemas help open up that hepatic portal circulation, which allows the liver to kind of run in overdrive to help to detoxify the body. So yeah, that would be another thing that we might consider.
And another thing that I'd like to say really quickly about toxins and carcinogens would be that includes any kind of scented lotions, that includes candles, that includes perfumes, that includes deodorants, that includes makeup, hair color. A lot
of those things that you're talking. In fact, probably all of them, if you're just buying regular conventional products that don't take steps and make efforts to get rid of those things, have phthalates and have parabens. And a whole host of other chemicals that are known to be what we call endocrine disruptors and hormone disruptors. So, that basically, is a, term that talks about things that can disrupt endocrine function. And endocrine dysfunction is really important. That's, your insulin from your pancreas to help control your blood sugars is an endocrine hormone. Your thyroid is part of your endocrine system. Very, very important things.
I want to talk about something really quickly that just popped in my mind, and you can tell me if this would be included in that. I've noticed for the last year, 2 years, that most of our clothes are no longer linen, wool, 100% cotton. They're plastic.
I think they've been like that for a lot longer.
Probably so,
I think
but
decades.
I mean, considering that we drink and eat out of plastic constantly, and now science is showing
We do not.
well, we don't, but the average consumer does, and now science is showing that they're literally finding plastic particles.
Yeah.
In babies and adults in the womb. And
I think that's I think that there's a perfect storm. I think that you look at the plastic clothes that we wear, you combine that with the horrible diets that we eat, and the leaky guts that we have, and the amount of inflammation that is in our bodies, and that's a perfect storm to create all kinds of endocrine dysfunction and inflammatory diseases, and of course the ultimate manifestation of that would be cancer. So
well, let's move on and let's talk about the Dutch test. And this is a really, really important one. This deals with hormones. I'm going to let you talk about that in detail.
So the Dutch test is the first thing that I would tell anyone is the Dutch stands for Dried Urine Test for Comprehensive Hormones, and it is exactly what it says it is. It's a very comprehensive test for comprehensive hormones. So we're looking at your sex hormones. We're looking at testosterone. We're looking at, we can go even back before that. We're looking at pregnenolone. We're looking at DHEA and DHEAS. We're looking at testosterone. We're looking at progesterone. We're looking at estrogen, and a lot of people don't realize this. Of course, you probably do if you're in medicine, but estrogen is a class of hormones. It's not just one hormone. There's actually 3 primary estrogens: E1 or estrone, E2 or estradiol, and E3, which is estriol. And then those hormones break down into what we call phase 1 estrogen metabolites, and then those get broken into phase 2 estrogen metabolites. And so at your, if you want to have your hormones run at your conventional clinic, you might get a total estradiol or a total testosterone, maybe even a free testosterone. And then a progesterone. But they're not looking at the metabolites. They're not looking at how the body's using those hormones, how the body's processing those hormones. And there's a lot that you can learn that you are leaving on the table if you're not assessing those hormones completely. The biggest problem that we run into, especially from a cancer standpoint, is looking at estrogen metabolism, because that seems to be a very big factor in things like ovarian cancer, prostate cancer, breast cancer, even things like colon cancer that you wouldn't necessarily associate with hormones. There's all kinds of evidence that estrogens and dysfunctional estrogen metabolism play a significant role in the etiology, and just how colon cancer works.
Well, and I want to say to that point, we are seeing a lot of colorectal cancers in women, in men, and very young women and men.
The young people are the highest growing demographic in colorectal cancer. And then also rectal cancer is becoming a much bigger, it used to be colon cancer more, and now we're seeing it more rectal cancer.
Yes.
So, whenever I think of that, I'm thinking about, what kind of soap are you using in the shower to clean yourself? What kind of toilet paper are you wiping yourself with? What kind of personal care products are making their way down into that area?
Medicated pad wipes.
Yeah, absolutely. Most of those have, parabens and phthalates or one or the other in there. All kinds of chemicals, sodium benzoate and EDTA, and, there's all kinds of things that are not natural that you're exposing to that, or could potentially be exposing to that, delicate mucosal tissue down there. And so, the way that I think that that's probably highly correlated with the development of those colorectal cancers. But then also it's metabolism. We do the metabolic approach to cancer. So you look at, now you've got the chemical exposure side of that thing, but now you go back and you look at the metabolism, and then you say, oh, well, yeah, now we can see that your estrogen metabolism is way off. You've got these phase 1 estrogen metabolites that are, you got one called 16-hydroxy-E1. That's very, very estrogenic. It's almost as estrogenic, and some people think even more so than estradiol, which is a primary estrogen. You've got another phase estrogen metabolite called 4-hydroxy-E1. That one is probably one of the most concerning, especially if it's high, because that one is actually known to bind to and irreversibly damage DNA. And so that can lead to some of the mutations that when you also have a bad metabolism due to the standard American diet, those factors will work together to make those cells dysfunctional and ultimately could result in a colorectal cancer.
And it is fixable. When your hormones are that crazy, it is fixable. We can do a lot. We can hit a lot of moving targets.
Sure. And then we also look at, which is a really, really important factor from a gut standpoint and also a hormone balance standpoint. We look at the adrenal hormones and how your adrenals are functioning. We look at a graph that shows your cortisol awakening response, which is your daily stress test, and whether your adrenals are doing what they should be doing when you wake up. And then throughout the rest of the day, things should just kind of be tapering off and everything. So do you have a big spike in the afternoon, or do you have just a flat line where there's really not a whole lot of activity in the adrenals? And so we can assess it's an indirect assessment of your stress level. And that could be emotional stress, that could be physical stress, but if your adrenal function, is low, then chances are you've probably been in fight or flight, that, sympathetic pathway for a really long time, and your adrenals have essentially just given up. In the very first, when you're under that fight or flight state, or that sympathetic state, your adrenals will keep up. And they'll compensate for a long time. But then eventually the adrenals are saying, all right, I give up. You win. And then the function just starts to go away. When that happens, and even in the first stages of that, if your adrenals are struggling to keep up with the demand of your stressful lifestyle or whatever you're putting your body through, well, then it's taking away those lipids and those cholesterols that would otherwise be made and turned into endocrine hormones or sex hormones. And so you'll see that is coupled with the decline in the sex hormones, but also gut function. Gut function is another thing that gets shut down when you're constantly in that fight or flight system or in that state.
I think one of the last specialty kits that I want to talk about, and then I'll let you kind of come around the back end. If there's any others that you want to bring up, please feel free. But I want to talk about the blood metals panel that we do. We assess for mercury and we assess for blood metals, and that is a very telling specialty kit. So the tri-metal blood panel that we get, and it also tests for mercury, is actually they get a hair sample, a urine sample, and a blood draw. And this one tests for, I'm going to let you tell us what this one's all about.
So that one tests for your mercury exposure, something that's commonly used in dentistry and has been for a long time. In conventional dentistry, it's not controversial, but if you talk to any biological dentist or holistic dentist, then you would, hear a very controversial side of things. And that mercury's used in dentistry very commonly, but it's not necessarily good for us. There's been a lot of research to prove, which I'm privy to, and it proves that mercury that's in amalgam is not stable, and it does leach out, and it can get into your tissues, and you can become toxic from it. There's a really good video that you could watch even on YouTube, probably, if it's still up. I haven't watched it in a while. And there has been a lot of censorship, but just type into YouTube the smoking tooth and watch and see what happens to mercury vapor when viewed through a special lens when the mercury fillings are heated up. So that kind of may stimulate chewing gum or chewing food, or the heat that you might get from drinking a tea or a coffee or something.
We know this to be true. We know that mercury leaches because I want you to talk about the meridian chart that we use. And I want to preface this by saying, out of all of the clients that we've had in the 2 years that we've had this this business, we've only seen 2 or 3 of our clients whose cancer did not correlate with that meridian chart, and I'll let you explain that.
Well, so ultimately, what we're looking at, part of our intake form is going through someone's dental history. And, so we get, not necessarily dental records, but we have the client go through dental records and tell us where mercury fillings are and where implants are and where root canals are and crowns and bridges and those types of things. And then we have a tooth chart that we diagram those out on, just like they would at a dental office. And then there are meridians in the body, and another term for meridian would just be energy pathways of the body. Our bodies are electric entities, and there's energy pathways that travel throughout the body, and those meridians go through our teeth and our dentition. And there's a huge association with our dental health to our overall physical health. And so what Ty was referring to earlier is that a lot of the time, the majority of the time that someone comes into us and has mercury fillings, specifically mercury fillings and root canals, seem to be the biggest offenders. And of those, I'd probably even say root canals are probably the biggest.
Yeah.
It's very common for someone to have cancer in the associated meridian of a tooth that has a root canal on it. And that is because there's no way even with all of the technology that dentists have access to now, there's no way to completely and 100% ensure that you don't trap bacteria in the canal after you've drilled the root out or after you've taken the root out. There's no way to ensure that bacteria are not in there. And so that leads to a significant risk of chronic low-grade smoldering infection on any particular meridian of your body. And then if you have other factors that might be, maybe you've got some mercury in your mouth, maybe your diet is a little bit less than optimal, maybe you're too stressed out, maybe your hormones are a wreck. And so, you start adding all of these things up, and that can potentially cause you to have, complex chronic disease or cancer.
Are there any of the other specialty kits that you want to talk about?
Well, I would like to talk about the rest of the blood metals panel, because the Quicksilver Trimercury test is great for assessing, multiple different types of mercury, organic mercury, inorganic mercury. So it's very, very thorough, and I can feel fairly confident based on the results of that test whether or not that needs to be an area of focus or not. Part of that test, or the rest of that test, is called the blood metals panel, and this is just a blood draw. That allows me to look at some of the other metals in your body. So we're looking at minerals and metals. So we're talking about copper and iron and mercury and calcium, and so I'm able to look at all of these metals, some of which are referred to as metalloestrogen. So we're looking at like cadmium and mercury are known as metalloestrogen. So those can actually activate certain hormonal pathways or send them into overdrive, because the body responds to those metals and in a similar way as it would respond to estrogen. So I'm really allowed to look at, or I can look at the results of those tests and look at mineral balances and metal balances, and if there's elevated levels of like antimony and lead and those types of things. So it just gives me an idea of what kind of detox do we need to do.
I absolutely love using Avexia Diagnostics for all of this, for the lab panels, for the specialty kits, and it is such a deep dive, which is why we call it the deep dive, that it covers every system of your body. It is an absolute full coverage, terrain-based type of examination.
Absolutely, yeah. And it makes things really easy. And, it's easy for us because we have, some semblance of control over that, and those labs come directly to us, so we don't have to get a third party involved, and that always, has the potential to create some discordance.
Yeah.
And but it's also easy for our clients because they come directly to us. Then we send them the requisition. Then they either get the lab shipped directly to their house in the case of a specialty kit, or they can just go to their local LabCorp or hospital and have those labs drawn and sent off. So it really is a kind of a great way for us to obtain all of the critically needed data that we use to do what we do.
It's a really well-rounded team.
Yep.
I feel like. Well, so from that point, I just want to talk about the deep dive. So we onboard people. We go over this huge lab panel. We assess their intake form. We get a foundational plan started, and then I do want to talk about the specialty kits. It does take anywhere from 2 to possibly 5 weeks to get some of those in. It just depends on the time of the year.
Yeah.
Depends on how overwhelmed some of these lab companies are. But so the specialty kits do take a little bit longer to get in than the labs, which is why we do the test, assess, address, and never guess motto in what we do. And so
well, detailed medical information typically takes time. And then I would also say, we all know what we've been through for the last 3 years or so now, and what kind of effect that's had on the medical system. So it's not uncommon for reagents to be, on back ordered, or for, lab tubes in some cases to be on back ordered. And so, I mean, the 4 to 5 weeks or 6 weeks, that can be extended for sure based on what's available. But of course, we have no control over that, nor does anybody else. So,
well, in between the onboard and the deep dive is really where my advocacy comes in. This is where I really keep in close contact with our clients, and we can help kind of regulate a supplemental calendar, I guess you could say, or schedule for our clients. We help them with dietary recommendations. We monitor their mistletoe. We actually can facilitate mistletoe, which we use for all of our cancering clients through Uriel Pharmacy. And so there's a lot of things that we do from the onboard to the deep dive. Sometimes it takes anywhere from 3 to 5 weeks to get to the deep dive from the onboard. It just depends on how quickly our clients dive into the specialty kits and get those taken care of.
Yeah. We've had people be ready, in as early as 4 weeks.
Yeah.
And then we'd also had people take as long as 4 or 5 months.
It's true. And so the journey really is dependent upon our clients and how they want to engage in the journey. But once we get to the deep dive, we sit down for another 2-hour consultation through Zoom, and we go over all of the deep dive tests. You have already got this amazing full plan for them beyond the foundational plan, because you've got all the information that you need.
Right.
And so we are able to go over that finalized plan. And then after the deep dive is done, we can move forward on a monthly plan with many of our clients, or our clients can just do quarterly labs and consultations with us. Really, the journey is in our clients' hands.
Yeah, we always tell our clients that they're the captain of their ship. They get to steer the boat, and so we really do the best that we can to facilitate that for them. So, and sometimes that may mean that they want to do something that we don't agree with, but that's okay, because they're the captain of their ship, and they get to steer the boat.
That's right. And we're here to honor their journey. We are here to give good recommendations, to give informed consent, to give our clients the most care they can possibly get. But in the end, the journey is theirs, and we're going to honor however they choose, whatever therapy they choose to venture into, whether it's oncology, no matter what it is, we are going to honor that, and we're going to do our level best to keep their terrain in an optimal place while they're engaging in these therapies, or this is a plan that can stand alone.
Right. Well, and I like that you brought up informed consent too, because that's an absolute hallmark of how we do things. It should be a hallmark of the conventional medical model, but it hasn't been for a really long time, and that's something that kind of led to me wiggling my way out of the conventional medical model and doing ultimately to doing what we're doing today. Informed consent was something that ultimately came out of the Nuremberg trials after it was found out that some of the government officials and doctors and under the Nazi regime in Germany had done really, really horrible things to some of the people that were in concentration camps. And a lot of people know about Dr. Joseph Mengele, and ultimately out of the Nuremberg trials came that the principle of informed consent, should be applied worldwide, and that nobody should be experimented with against their knowledge. So that means that prior to the start of any new medical therapy, you need to be given the pros and the cons, the benefits and the contraindications, and what could potentially happen, maybe side effects. You need to be given that on all of the potential options, so that you, as the captain of your ship, can decide on the right medical therapy for you. And of course, I always add into that I think it's certainly appropriate for a doctor to say, based on my medical knowledge, this is what I recommend.
Yeah.
This is what I would do for myself. This is what I would do for my wife or my son or whoever.
Sure.
And then the patient gets to make that decision. Now, that's not necessarily how things work now in conventional medicine. You basically go in and you get told what you're going to do. And if you don't like that, you might get some pushback from the doctor, to say it nicely. And so that's a really common thing that happens, but that's not from a position of informed consent.
Right.
So a lot of things have happened in our country and in the conventional westernized medical model since the end of World War II, after the Nuremberg trials, to kind of push us away from informed consent. And I think that the most obvious example of that would be what we've been through with the campaigns over the last 3 years, and I'll just leave it at that.
Yeah, I totally agree. One thing that I do love about our service is that even when our clients are recommended to venture into other therapies, such as chemotherapy, radiation, things of that nature, they can come back to us and tell us what their oncologist has suggested, and you give them fully informed consent, which they do not get a lot of outside of our service.
Yeah, I look into a proposed plan, or in some cases even the plan that somebody's on whenever they come into our service. And I will go through and I'll look at the a lot of the conventional guidelines, and I'll say, hey, is this even an appropriate therapy based on the conventional guidelines? And then I start looking into my background as a more of a integrative from an integrative oncology standpoint, and I start looking at, okay, well, so based on this person's terrain, which I can 100% tell you that I know more about my client's terrain than any of the oncologists that my clients see. Hands down. It's not even a remote close thing. So I am looking at this person from a very, very informed perspective, whereas an oncologist, if you look at a lot of the labs that they get, they're just very, very basic labs. They also don't get to spend as much time with their patients as I do with our clients. So when I'm looking at those plans, sometimes I see, oh, well, this chemotherapy or this immunotherapy or this steroid or this, immunosuppressant is not appropriate for you based on your terrain. And sometimes, probably the majority of the time, they're like, okay, well, let's get off of that. And and sometimes they don't, but again, they're the captain of their ship. Sometimes we get pushback from the oncologist. But we also try to educate and teach people how to be their own advocate. And that's a lot of what your job is as the client advocate, is really helping somebody to, be able to say, oh yeah, this is my life. I get to make this call. I don't have to let this pushy oncologist tell me that I have to do this.
That's right. I want to talk about one particular case that we have. We have a client in our service who has liver cancer. And he was at the end of his journey with chemotherapy. His oncologist told him that basically chemotherapy had failed him. There was not much more that they could do.
Right.
We started this client on alpha lipoic acid IVs, and which is a game changer for many who have liver cancer. And his oncologist actually came back and said, you know what, I found a liver specialist that I think can help you. So our client went to Dallas to work with a liver specialist.
He was enrolled in a trial.
Yes, and he wasn't really given the details, and so we work with our clients on what particular questions to ask and what lingo to use. For instance, we had to tell our client, what's the plan? And he said, I don't really know. And I said, this is exactly how we need you to state this. What is the end point to this chemotherapy?
Well, it was actually more specific to that. what we advised him to ask was, is this, are we going for a cure at this point? Or is this what is referred to as palliative chemotherapy, which is basically, maybe life extending, but not with the goal of a cure.
And with what kind of quality. And so our client was absolutely floored, because when he came back to us with the oncologist's answer, it was, there will be no end to chemo.
And it's palliative and not curative.
Yes. And so, but guess what? He's off of chemo. They can't find cancer.
Yeah.
And so he's in a great place.
Yeah, he is.
Yeah. So, well, I think that about wraps it up for us. We've been wanting to kind of go deeply into this, this part of our program and how we can help people and kind of what the time frame looks like on that. And I was telling a client this morning that if you're not used to engaging in your own health, if you're not used to researching, if you're not used to God's way of doing things, it's literally like learning Chinese overnight.
Yeah.
And that is where my advocacy comes in. You don't have to learn Chinese overnight. I will teach it to you very, very slowly. We will walk through this together day by day by day until we get that whole big meal eaten one bite at a time. Right?
Well, and for those with complex chronic illness and cancer as as one of those, typically the plans that I put together for people are it's a full-time job.
Yeah.
I mean, it's a lot. It's supplements, it's lifestyle, it's, a new diet that most of our folks have never eaten before, and it can be very hard and very frustrating, and, and that's where your job comes in to just kind of help people. We never expect perfection. We expect people to do what they can, and that's
right.
One day at a time, and that typically involves just slow progress toward the goal.
That's right.
And of course, depending on where somebody's at in their journey, sometimes we need them to go faster than that. Sometimes we can slow roll some things, and it's okay. Ultimately, the decision whether to do that or not is up to them. But we just try to be here to the best of our ability to help them go at whatever pace they feel comfortable with.
That's right. That's right. Wicked smart you are.
Wicked smart.
Wicked smart. I really appreciate all of the, the in-depth descriptions to all the specialty kits and
You bet.
how they will be utilized and how you give an overview of that. So we want to thank you guys for joining us today. This is episode 3 of Health Matters. Be good to yourself because your health matters.
And expand your worldview.
Expand your worldview. You guys have a great weekend.